Wegener granulomatosis is a small vessel vasculitis, and the vessels that are affected are isolated to the lung, the nasal passage, and really the entire tract down through the lung. And the kidneys are affected. So really, lung and the tract and the kidneys are affected in Wegener granulomatosis. So think about what happens if you damage anything along this tract along with the kidney. If you damage small blood vessels in the nasal passage, you may get bloody nasal discharge. If damage gets severe enough, you can cause disruption and deformity to the nose. It'll look kind of like it's caved in. You'll get more of a curled nose. And that's called saddle nose deformity. You may see other symptoms like chronic sinusitis. Constant inflammation in the sinuses causes this chronic pain and this blockage of sinuses due to swelling. And you can really get problems in your trachea, so the windpipe itself may get constricted. It may become difficult to breathe. So you have this collapsed trachea. And of course, you might get bloody sputum or bloody spit or bloody coughing because both your lungs are damaged. Remember, if it's a small blood vessel disease, there really isn't much in the way if it ruptures. So take a look. Here's a small blood vessel. These two lines represent the vessel wall, and blood cells pass through. If you rupture this wall, cells escape really readily. And so that's why you can get blood in your lungs, blood in your nose, and that sort of thing. And symptoms such as the saddle nose deformity and the collapsed trachea are from decreased blood to those tissues. And so they die. It's a necrotizing vasculitis, cell death. That's what necrosis means. And so you also see this occurring in the kidney as well. And this damage causes decreased filtering of the kidney, and so you may have blood volume increased because blood can't really get out and go through the filtration system, which is the renal system, the kidneys. And so you might see increased blood pressure and decreased urine output. So decreased urine because you're no longer filtering. Now this disease I like to remember with the letter C. In fact, I like to think Wegener's granulomatosis to really remember all of the symptoms that are involved. If you draw a big C on this body, you can remember that the nasal passage, the trachea, the bronchi, the lungs are all affected, and the kidneys affected too. In fact, I drew these little kidneys as a C, so you can kind of remember that too. So you've got this lung, nasal passage, and this entire tract, and kidney involvement. Another important thing to note is the involvement of antibodies known as cANCA. ANCA stands for anti-neutrophilic cytoplasmic antibodies. Remember, in vasculitis, white blood cells are going haywire and releasing a lot of immune proteins that can cause damage. And all this material is coming from inside of these white blood cells. Now, it's important to note these white blood cells are known as neutrophils. So these components come from the cytoplasm, or in other words, the inside of the neutrophils. So it's from the cytoplasm of the neutrophils. And B cells, which are white blood cells responsible for the creation of antibodies, see all this material and release a lot of antibodies. Along with cANCA, we also have another type of ANCA called pANCA. And basically, they're responding to different components within the neutrophils. So these immune proteins that are being released aren't just one type of protein. There's many different things that are released from inside of the cytoplasm of the neutrophil. And so different types of antibodies, pANCAs or cANCAs, can be created. And 90% or more of patients are noted to have cANCA when they have Wegener's. So this is a good way to test for somebody who has Wegener's. Using C as a mnemonic is also good for remembering the treatment. One of the treatments is corticosteroids, and the other treatment is cyclophosphamide. These both act by inhibiting the immune system. So they are the treatment for Wegener's granulomatosis. Now, to diagnose Wegener's granulomatosis, you need to have evidence of cANCA, and you also usually pursue a biopsy. Now, what's a biopsy? It's when you take a cross-section of a tissue, such as in the kidney, and look at it under a microscope. And what do you see under the microscope? Under the microscope, you'll see granulomas, right? Wegener granulomatosis. What's a granuloma? It's when you have white blood cells working together to form a circle or a sphere around something they think is foreign. It's a way to block off whatever this material is on the inside. When your immune system can't break it down or destroy it, it essentially hides it from the rest of the body and prevents it from escaping. So this is known as a granuloma. And that's really easy to remember because of the name Wegener granulomatosis. Now, aside from granulomas, in the kidney you can see the glomeruli being affected. Now, what's a glomeruli? Well, in the kidney you have these little balls called glomeruli. You've got blood vessels that go around them, and the glomeruli act as a filter to filter the blood. Now, what happens in Wegener granulomatosis? Well, the blood vessels in the glomeruli get really inflamed, and this inflammation starts to affect the entire glomerulus. And so you see swelling. This swelling pushes the glomerular membrane and creates this crescent shape. Remember, this is a glomerulus. This is how your kidney filtrates. You get this crescent shape, and that is our other C that we can think of when we're talking about Wegener granulomatosis. So on biopsy, you can see crescent formation in the kidney. And so that's really a good mnemonic to remember Wegener's granulomatosis. Let's go ahead and actually move this further down so we can make room for this other disease. It's called microscopic polyangiitis. So many blood vessels are affected, and it's microscopic, so you want to think small vessel vasculitis, just like Wegener's. Now, microscopic polyangiitis is different from Wegener's because you see pANCA instead of cANCA. And around 80% of the patients will have this pANCA. Why you get a different type of ANCA, anti-neutrophilic cytoplasmic antibody, is really unknown, but it's a good way to tell the difference between these two. Another great way to tell the difference is microscopic polyangiitis only affects the lungs and the kidneys. There is no nasal or pharynx or tracheal involvement. In other words, no nasopharyngeal involvement. So it's really confined down to the lungs and the kidneys. And lastly, on biopsy, there are no granulomas seen. Whereas in Wegener's, of course, you have granulomas, if you remember the name Wegener's granulomatosis. And so those are ways you can differentiate between these two diseases when you're considering vasculitis for your diagnosis.